By the end of this presentation, we expect you to know of you volunteers and that of nurses that we got in our communities. We also know the barriers to effective promotive health care and behavior change, and successful facilitators that we'll be using for our programs to be successful. We got some recommendation and that of the conclusion. So, preventive health care, it actually focuses on the action that can be taken to prevent diseases rather than preventing them after they occur. So we have to prevent diseases before it occurs. So in preventing diseases, we are urged to what? Give health awareness, educate community dwellers. Because if you not communicate, educate people, they may not have knowledge on diseases that are happening in their communities. So you have to educate people on certain behavior that they are doing in the communities. And early detection, if we say early detection, meaning you are going in the community to identify the problems that the people are facing in the communities. Because if you don't identify it, they will keep doing it. And they will feel like they are doing the right thing. And at the end, they may come down with chronic diseases. In local community, in low income, middle income setting, like for Liberia, we are not a rich community. We are a very poor community. So you will see people coming down with a lot of diseases. And most often they are not aware. If people are aware, they will prevent themselves. So you as a volunteer, it's your sole responsibility to make people to be aware through health education and promotion. It's very essential because it also reduces morbidity and mortality, which is the death rate and that of diseases. Alone, if you're supposed to pay, now JJ Dawson is paying money, right? So if you volunteers, we are volunteers now going in the community to talk about health. If we don't talk about health, certain community will always come down with a lot of diseases like malaria, hypertension, and that of diabetes, because they don't know what they need to do to live long, to keep themselves healthy. They don't know. So you as a volunteer, is your responsibility to go out there. This is why we are having this training, so you can be well educated to go out there and give back to the community. The major factors of preventive healthcare is behavior change. Behavior change is not an event, it's a process. You can go in the community and you just tell me that, oh, please keep your surrounding clean. And I will say, okay, I hear that. You need to come every time to let me know what to do. So behavior change is a process, it's not an event. It's not something that you can do one day. You have to keep doing it so that the people can be aware. And before you change somebody, you have to listen to them, identify their problems, see what they were doing first, and now how you are going to change them. Like we got diseases like hypertension, HIV, malaria. For HIV, most people just go about, excuse me to say, having sex, unprotected sex. You just met somebody. You don't know their health status. You don't know what they are carrying. You just post on what they are carrying. There. You have to have a condom. So if you go in the community, you have to educate people how to people. You have to educate people how to use condom. The use of condom is very important because we have many sicknesses, the hepatitis, we have HIV, we have many sicknesses that can be passed through sex. So you have to use condom. So you as a volunteer, if you go in a community, you have to choose a topic and make sure you master that topic. Make sure you got all the juice for that topic to be able to tell the community members. And if you are telling them, you are not going to use your jargons. You are not going to use big English. You are going to use a simple English so that they can understand it and then pass that information that to those who will not be there or to people that they will meet, maybe in church, because they can have community meetings, tribal meetings, they will be able to spread the information. But if you go with your big English, when you finish talking, the people will say yes, they understood it, and they will leave. And when you come back, you will still see them doing those similar things that you met them doing. So to promote perspective must the target both individual behavior and the social determinant of health. So we got social determinant of health. We got plenty of things that can affect our health, our lifestyle. So you as a volunteer, you have to look at these things and know how you go in the community to talk about them. So we will look at the concept of preventive health care. Preventive health care can be categorized into 3 levels. And level 1 is primary. In the primary section is where you are mainly focusing on stopping diseases from happening. So as a volunteer, this is our main place we'll be focusing on. From stopping diseases from happening through education. You are going there to educate people. You are going there to inform people about conditions so that they can move to where they were and go in front and change their behavior to certain good way of health. So example could be vaccination, education, and nutrition. So many times we see babies' mother in the community. You will see that children take the first vaccine and the second vaccine, the third vaccine, up to completing, graduating, they are not doing it. So as a volunteer, you are going there to check. They got the vaccine book. In that book, we got a return date. In the return date, you are going to check, you are going to ask for the baby vaccine book. It should be one of the things you are going to do. Ask for the book. If you see the child is a small little baby, up to maybe from birth to 2 years, you can ask for the child vaccine status to see if the mother carry the child for vaccine. So the book will be okay. You check in the book at the left corner, you will see the return date there. It's important to check so you can be able to tell the baby mom to go at the facility to get the child vaccine. Nutrition. Most of the time we see children are malnourished. People don't have knowledge on what food to give the children. People don't have knowledge to say, oh, if the child is from birth to 6 months, you have to breastfeed the child until the child reaches 6 months. Don't give water. All these things can happen. If you don't do it, you start giving the child all type of food, the child comes down with malnutrition. The child is malnourished, and the child will be placed on the bed, or even food. People can call it, I know how they can call that. So it's peanut butter. Yeah, but some people can call it malnourished. It's not malnourished. It's plumbing no. So they will give it to the child based on the MOA. They got certain thing or script. They will put it on the child here and then examine the child, so they can see if the child falls in red, yellow, green. If the child falls in yellow, the child is partially malnourished. If the child falls in red, the child is malnourished. So all these things, we have community workers already in the community. They call them CHPs. You can link with them. We got TTMs in the community. You can also link with them for referral sake, because they got their referral forms. So you can link with them. You can work together so that that person can be referred at the facility. Because in the community, the people already know those CHPs. They already know the TTMs. So it will be better that we work with them, so at least our work can be easy. The next thing is the secondary prevention. Early detection and prompt treatment is where, if you are not doing the prevention part, the person may likely come down with the disease and need treatment. So it's the secondary category we are on. So if the person comes down with the disease and need treatment, the person needs to go to the hospital or any nearby facility to take treatment. So in that treatment, the person will be screened for hypertension and that of diabetes or cancer or any chronic disease that they will be presenting based on their signs and symptoms. So if you go in the community too, you need to screen. Screening is not like carrying materials like BB cough or something. Screening is all about asking, how are you today? Are you been coughing? You been having fever? Screening could make your work easy. But if you don't screen and you just give the health education to the people, they may likely say, I hear you, and they will go away. But if you ask them, how are you today? How you feeling? Are you been having fever, coughing, stomach running? They will say yes. Then you can link them to the facility to take treatment. So the tertiary prevention is where you have to reduce complications and disabilities. The person already, they are sick and they have complications. So the first thing, the primary, if you don't give the health education to the primary portion, the person will come down to tertiary, which is they will get sick and they have to take treatment. And the tertiary, if maybe they don't listen to you based on your health education, they may come down with complication. And then that complication, maybe it will be a lifetime thing that they will live with. So that the reason why getting information, giving awareness on condition is good, so that people cannot come down to the secondary for them to be taking medication. And taking medication, if they don't take medication, they sit in the house, it will come down with complication. One example can be in the church yard. We have to be focusing church yard, because in church yard, people actually, they are doing well there because our cultural values, people believe they need to go to the church yard to seek some other things. But firstly, we have to come to the hospital. So if we are focusing as volunteers, we want to go to the church yard. If you are going to the church yard, like my brother presented, you have to do a community entry. doing a community entry, you telling the people what is your purpose of your visit there. Then they be aware and give you the time. Then you talk to the people, because some of them, they are carrying a lot of conditions that they don't know about. They are not aware of their condition. They just sitting there thinking that that is a spiritual thing. We got medical thing, we got spiritual thing. But first, let us go at the hospital so that we can see if that's spiritual or that medical. So preventive healthcare in higher cost, effective, and reduces the burden of healthcare system by addressing risk factor early. So if we all get on our feet to prevent, to promote, to give awareness, we will not be spending money for our health. We will be healthy in body. We will use that money for different things instead of going to the hospital. Most of the time when you reach to the hospital on a Monday, the hospital is very packed, because you see, people are not getting the message. Some are getting the message and they are not implementing it. Like for sleeping on a mosquito net, cleaning your surroundings. These are simple things. Some people, they give them the mosquito net, but they're using it to fishing. They're using it to, keeping it as, I don't know, the lake. The other time I was right at Stadium Road, at the time I was living there, when the lake opened, you will see everybody going for that new mosquito net and putting it in a place for fishing. It's not really good. The donors that are giving those things, if they come, they will feel very bad, because people needed to sleep on the mosquito net, but now they are using it to fishing. Because of our economic system, we don't have also knowledge on some things, and we are from poor place. So to get food is hard for our family. So we just have to use what is available and accessible to us. Not looking at who gave it and the purpose of which they gave it for. Next slide.